We continue our conversation about an alarming cancer study we first told you about last week. The American Cancer Society says cancer is on the rise in younger adults. Generation X and millennials in the U.S. have higher risk of developing 17 cancers compared to older generations. That's what the new study is suggesting. The American Cancer Society researchers stress the need for interventions to address the rising burden of the early onset cancers can have in younger generations. And joining us right now to discuss more about this alarming study is Dr. Usman Khan, a hematologist oncologist with North Mississippi Medical Center Cancer Care in Tupelo. Thank you so much, Dr. Khan, for joining us this afternoon. First off, did you read the study? And if so, how alarming and concerning is it for you?
Thank you so much, Tanya, for having me and highlighting this very alarming trend. So I would like to go back to this study and just look into a little more detail. So as you mentioned, out of the 34 cancers what they looked at, out of that 17 are rising in incidence in younger population. And out of those 17, 9 of these cancers are actually decreasing in incidence in the older population. So this is an alarming study, and the American Cancer Society is now kind of shifting the increased incidence of cancer in younger and younger middle-aged population compared to older population, which is very alarming.
Now, when it comes to you being a hematologist, oncologist, what are some of the cancers that you're seeing right now in younger people?
So we are seeing increasing trend of breast cancer, most of gastrointestinal malignancies like pancreatic, colorectal, and gastric, and then some of the cases of early onset testicular cancers and head and neck cancers are increasing in alarming trend, which we are seeing in our clinic settings.
Now, what can young people do right now just to make sure that they don't become a statistic?
So the important thing in this situation would be screening and prevention. We need to look back and see what are the reasons why these cancers are increasing. There are a lot of hypotheses, but broadly we can look into the lifestyle changes, environmental factors, and then family history, which are one of the major things which can contribute to these early onset cancers. We are seeing that as a population, our lifestyle is becoming less healthy. We are more sedentary, less physical activity. Our diets are moving from more natural to more processed and ultra-processed foods. Mm-hmm. So these are some of the hypotheses that we are looking at could be the reason for increasing incidence. One of the other major things for younger population has to look into is their family history. Mm-hmm. If there is a family member who had a cancer, I think the people need to talk to their doctors and inform them about their family history, because that way they can be screened early. Mm-hmm. And these cancers can be detected early, where it could still be at a stage where the treatments can help them.
Now, before we let you go, this is just a study in which the researchers right now are looking at ways for interventions, and that means possibly earlier screenings.
Yes, so that's going to be one of the important factor in these early onset cancers. When we come up with these screening protocols, they usually look at population versus individual, and we can see over the past few years that the screening populations for these different cancers are moving through early age groups. Like for colon cancer, mm-hmm. where the early onset, the age moved from 50 to 45. So I think that's going to be mm-hmm. an important part of this, to move these screening protocols to more younger, mm-hmm. so that we can include more younger people in these screening for these different kind of cancers.
All right, then thank you so much there, Dr. Khan, for joining us this afternoon.